Welcome to the Department of Health's online information modules for the National Aged Care Mandatory Quality Indicator Program, also known as the QI program, for residential aged care services. This module is one of a suite of resources available to support services to understand and meet their obligations under the QI program. During this session, we will take a closer look at the first quality indicator, or QI, pressure injuries. We will discuss the why, what and how of collecting and submitting data for the pressure injuries QI. We will also touch on QI reporting and how to use service level reports to track progress and inform continuous quality improvement. By the end of this session, you should have an understanding of the objectives of the QI program, pressure injuries and some of the reasons why they may develop, the importance of monitoring pressure injuries, QI program requirements for the classification, data collection and reporting of the pressure injuries QI, and where to find further information about the QI program. So what is the QI program? From 1 July 2019, participation in the QI program became a requirement for all government-subsidised residential aged care services. It is now mandatory for residential aged care services, including respite services, to submit QI data to the Department of Health every 3 months. The following programs are currently excluded from the QI program: flexible care, including transition care, the short-term restorative care program, multi-purpose services program, the National Aboriginal and Torres Strait Islander Flexible Aged Care Program, and the Innovative Care Program. The objectives of the QI program are for providers to have robust, valid data to measure and monitor their performance and support continuous quality improvement, and, over time, to give care recipients transparent, comparable information about quality in aged care to aid decision-making. The QI program may benefit your service by providing a set of meaningful and measurable QIs to assist your service to monitor and improve important aspects of care, enabling your service to monitor and identify trends in performance over time, compare with other services, and implement improvements that will promote quality of care and quality of life, and, over time, through the publication of information about the QIs, the QI program may enhance community understanding of the high-quality care your service provides and assist care recipients with choices and decision-making about their care. The QI program involves specific methods for collecting, recording, submitting and interpreting information about the QIs. It is important for the reliability of the QI program that your service uses the methods exactly as prescribed in the QI program manual. The QI program currently includes 3 QIs that address important aspects of quality of care in clinical areas. These are pressure injuries, use of physical restraint, and unplanned weight loss. Each indicator has categories for which data is collected through assessments and measurements. Data needs to be collected for a total of 10 categories across the 3 QIs. We will explore each of these categories in further detail as we look at each of the QIs. Let's take a closer look at the first quality indicator, pressure injuries. So what is a pressure injury? A pressure injury is a localised injury to the skin and/or underlying tissue, usually over a bony prominence, as a result of pressure, shear, or a combination of these factors. The tolerance of soft tissue for pressure and shear may also be affected by microclimate, nutrition, perfusion, the presence of other medical conditions, as well as the overall condition of the soft tissue. It is important to note that research has identified older age as a common risk for the development of pressure injuries. Health issues that may affect people in older age and contribute to pressure injury development include changes to skin integrity, malnutrition, chronic disease, immobility, incontinence, and impaired cognitive status. There is substantial research demonstrating that the development of pressure injuries is a significant issue for older people living in residential aged care. Common adverse events associated with pressure injuries include pain and discomfort, reduced physical function, infection and cellulitis, and death. These, as well as the considerable financial cost to an organisation caring for people with pressure injuries, may be avoided by taking preventative action. There are 6 categories of data to be collected within the pressure injuries QI, corresponding to each of the stages defined by the National Pressure Injury Advisory Panel, NPIAP. These definitions are very important when it comes to collecting good data, and everyone collecting data must do so in the same way and against the same pressure injury stages. Data collectors for this quality indicator should be well trained in determining the stage of pressure injuries according to the pressure injury classification system referred to in the QI program manual. The QI program does not require a registered nurse to undertake the assessments. However, it is essential that a care worker or anyone else undertaking skin checks has the education and knowledge to do so competently and safely. If the person undertaking the assessment is unsure or has any concerns, these should be referred to an appropriately qualified person. Best practice would be for the staff member to refer any concerns to a registered nurse. Further information about these stages is also available on the NPIAP website. Features of Stage 1 pressure injuries include intact skin with a localised area of non-blanchable erythema, which may appear differently in darkly pigmented skin. Presence of blanchable erythema or changes in sensation, temperature or firmness may precede visual changes. Colour changes do not include purple or maroon discoloration. These may indicate deep tissue pressure injury. Features of Stage 2 pressure injuries include partial thickness loss of skin with exposed dermis. The wound bed is viable, pink or red, moist, and may also present as an intact or ruptured serum-filled blister. Adipose, fat, is not visible and deeper tissues are not visible. Granulation tissue, slough or eschar are not present. These injuries commonly result from adverse microclimate and shear in the skin over the pelvis and shear on the heel. This stage should not be used to describe moisture-associated skin damage, including incontinence-associated dermatitis, intertriginous dermatitis, medical adhesive-related skin injury, or traumatic wounds such as skin tears, burns, and abrasions. Features of Stage 3 pressure injuries include full-thickness loss of skin in which adipose, fat, is visible in the ulcer, and granulation tissue and epiboly, rolled wound edges, are often present. Slough and/or eschar may be visible. The depth of tissue damage varies by anatomical location. Areas of significant adiposity can develop deep wounds. Undermining and tunnelling may occur. Fascia, muscle, tendon, ligament, cartilage or bone are not exposed. If slough or eschar obscures the extent of tissue loss, this is an unstageable pressure injury. Features of Stage 4 pressure injuries include full-thickness skin and tissue loss with exposed or directly palpable fascia, muscle, tendon, ligament, cartilage or bone in the ulcer. Slough and/or eschar may be visible. Epiboly, rolled edges, undermining and/or tunnelling often occur. Depth varies by anatomical location. If slough or eschar obscures the extent of tissue loss, this is an unstageable pressure injury. Features of unstageable pressure injuries include full-thickness skin and tissue loss in which the extent of tissue damage within the ulcer cannot be confirmed because it is obscured by slough or eschar. If slough or eschar is removed, a Stage 3 or Stage 4 pressure injury will be revealed. Stable eschar on an ischemic limb or heel should not be softened or removed. Features of deep tissue pressure injuries include intact or non-intact skin with localised area of persistent non-blanchable deep red, maroon, purple discoloration or epidermal separation revealing a dark wound bed or blood-filled blister. Pain and temperature change often precede skin colour changes. This injury results from intense and/or prolonged pressure and shear forces at the bone-muscle interface. If necrotic, subcutaneous or granulation tissue, fascia, muscle or other underlying structures are visible, this indicates a full-thickness pressure injury, meaning unstageable, stage 3 or stage 4. To get the most accurate information possible, it's important that everyone collecting the data does this based on the classifications, measurements and assessments prescribed for each QI. This information is contained in the National Aged Care Mandatory Quality Indicator Program Manual, which is available on the Department of Health's website. The QI Program Manual supports a consistent approach that allows services to compare results across collection quarters with other services, as well as against national averages, by prescribing methods for classification, data collection and reporting of the QIs. Information from existing data sets, for example incident reporting systems, must not be used where information has been collected differently to QI program requirements. Assessment of pressure injuries must be through actual observation, including a full body examination. Where possible, this should be done as part of routine care processes. One observation assessment is required for each care recipient every QI program quarter. These assessments should be conducted on or around the same time and date in each quarter for that care recipient. It is important to note that there is no requirement for all care recipients at your service to be observed on the same day. For example, the data can be collected by allocating a 2-week period every quarter to complete all pressure injury observation assessments. The department is not prescriptive about how services choose to structure observation assessments, only that it's important to be consistent and collect pressure injury data on or around the same time every quarter for each care recipient. Please also note that the Pressure Injuries Quality Indicator has no exclusions. All care recipients, including respite and care recipients receiving end-of-life palliative care, should be assessed and included in your service's quality indicator data. Instances where pressure injuries are present on admission, or if the pressure injury developed while the care recipient was away from the service, for example in a hospital, should also be included. Context for these cases can be provided in the comments section when submitting quality indicator data in the My Aged Care Provider portal. It is also important for all services to collect the most accurate information possible, and everyone conducting assessments and measurements should be clear on the prescribed methods for each quality indicator. Let's take a closer look now at what those prescribed collection methods for the Pressure Injuries QI are. The prescribed collection methods for the Pressure Injuries Quality Indicator are asking the care recipient for permission. The care recipient must be told about the assessment and must consent to include their data in the QI program. If they withhold permission, note this in the comments section of the data collection sheet. Conducting a full body assessment, preferably as part of routine care processes. Count, classify and record all observed pressure injuries. Seek advice from a suitably qualified clinician if you are unsure, and record on the data recording sheet available on page 51 of the QI Program Manual, including relevant comments to provide context. Now let's take a look at a few scenarios. In this part of the module, we will work through a couple of scenarios, classify, collect and report the results on the data recording sheet, and prepare the data for entry into the My Aged Care Provider portal. Okay, let's get started. You work at the ABC 123 Residential Care Service, where you look after 6 care recipients. The QI program does not require you to assess all care recipients on the same day, only that each care recipient's observation assessment is completed on or around the same time each quarter. In line with these requirements, you have decided to split the observations across the period, completing half on the 3rd of August and the other half on the 6th of August. Mr. Seth consents to the observation assessment taking place and his data being included in the QI program. Mr. Seth has entered the service during this quarter, and his notes show that he had 2 existing pressure injuries on arrival. Both were identified as stage 3 on the posterior aspect of each heel bone. You note during your observation that both stage 3 pressure injuries are still present. You observe Mr. Seth has no other pressure injuries. You record the 3rd of August as the date observation was undertaken. As you counted 2 stage 3 pressure injuries, you count and record both. In addition to the count, you note in the comments 2 Stage 3 pressure injuries were present on arrival. The comments you include in relation to pre-existing pressure injuries will be visible on your QI reports and provide context to your QI results. Next, you observe Mrs. Jaya. As always, before you start the observation, you confirm that Mrs. Jaya consents to being assessed and having her data included in the QI program. You note that Mrs. Jaya has recently returned from 6 weeks in hospital where she was treated for pneumonia. Upon her return, nursing staff noted that Mrs. Jaya had developed a new Stage 2 pressure injury over the sacrum during her hospital admission. You note during your observation that the Stage 2 pressure injury is still present. You note that Mrs. Jaya has no other pressure injuries. You record the 3rd of August as the assessment date and the presence of one Stage 2 pressure injury. It is important to note that although the pressure injury occurred external to the service, the QI program definitions still count the pressure injury to allow tracking total number of pressure injuries. You also record a comment that care recipient acquired a Stage 2 pressure injury during a hospital admission this quarter. Your final assessment today is with Miss Brown, who is at the service for respite care. Miss Brown consents to the process and is found not to have any pressure injuries. This is recorded on the data recording sheet. All care recipients must be accounted for in recording and reporting, including those with no pressure injuries. That concludes assessments for the first group. Now let's look at our next group of care recipients. On 6 August 2019, you carry out assessments for care recipients Mr. Maith, Ms. Toulis and Mr. Fraser. Mr. Maith consents to the observation assessment taking place and his data being included in the QI program. Mr. Maith is receiving end-of-life palliative care and is found to have a newly developed Stage 1 pressure injury. Ms. Toulis provides her consent and is assessed and found not to have any pressure injuries. You record this information for both care recipients on the data recording sheet. Mr. Fraser did not consent to the observation assessment taking place, and you are unable to record his pressure injury data. You note this information on the data recording sheet. Next, you tally your results for this quarter, ready for transfer to the summary data sheet for submission into the My Aged Care Provider portal. To finalise this period of data collection, you must complete the summary data sheet in order to prepare the data for entry into the QI part of the My Aged Care Provider portal. It is at this point you must compile the following information. 1. The number of pressure injuries at each stage for each care recipient. 2. The total number of occurrences of pressure injuries assessed in each category within the NPIP staging system. 3. Any related comments including A. The number of care recipients, including respite care recipients, admitted during the current reporting quarter where pressure injuries were present on admission. B. Noting instances where a pressure injury developed while the care recipient was away from the service, for example while in hospital. C. Noting instances where a pressure injury is present on a care recipient receiving end-of-life palliative care. Example data recording and summary sheets can be found on pages 50 and 51 of the QI Program Manual. It is important to note here that the comments you upload into the portal are displayed on your QI reports. Do not include any personal information in any of the data you submit to the department. This includes information such as care recipient names, initials or bed numbers. You should now review the summary sheet and, when you are ready, click Next to view the data submission page in the My Aged Care Provider portal. Data needs to be transferred from the data summary sheet into the My Aged Care Provider portal. All users can enter QI data. However, only your services administrator can submit the data. If you are not the administrator, you can save and finalise the data, then workflow this to your services administrator to submit the data for the quarter. It is important to note that all data must be finalised and submitted each quarter prior to the submission deadline, which is 21 days after the end of each quarter. Your My Aged Care Outlet Administrator is responsible for submitting your QI data via the My Aged Care Provider portal. As you can see, using a summary data sheet that mimics the design of the My Aged Care submission screen, will make the data submission process easier. If you are the My Aged Care Outlet Administrator and you would like to find out more about how to set up and use QIs within the My Aged Care system, please refer to the Quick Reference Guides or QI Program Manual, which are available on the Department's Quality Indicators webpage. 3 service-level reports will be available via the provider portal. These will become available 7 days after the data submission due date for the quarter. The reports include a Quarterly Facility Summary Report, Quarterly Facility Detailed Report, QI Report graphical displays. Any staff member or team lead can run these reports once their My Aged Care Outlet Administrator has enabled their QI role. These reports will provide a summary of your data and allow you to track progress over time. Service-level reports can be used to track quality indicator data over time and identify areas for quality improvement. Multidisciplinary teams are encouraged to consider this data and any factors corresponding to increased or decreased prevalence rates. For example, a service may invest in new pressure injury minimising mattresses based on advances in technology and current evidence in research. The service subsequently observes a reduction in the prevalence of pressure injuries in their QI data. The service might then take that to the aged care organisation to demonstrate the benefit of this change for their care recipients. These reports will allow services to view their results for the current quarter, as well as compare them to the previous quarters. They also report a percentage change in the data reported against each QI. Additionally, the reports will provide the service with year-to-date averages for each measure and provide national averages for this quarter and year-to-date. National aggregate de-identified quality indicator data for each quarter is published on the Australian Institute of Health and Welfare's Gen Aged Care Data website. This published QI data will include national, state and territory level participation statistics across all providers and summary statistics for each QI. Data at the individual service level is not published. More information can be found on the Department's website on the National Aged Care Mandatory Quality Indicator Program page. For your convenience, we have listed some of the key QI resources. Congratulations on completing the Pressure Injuries Quality Indicator Information module. You should now have an understanding of the objectives of the QI program, pressure injuries and some of the reasons they may develop, the importance of monitoring pressure injuries, QI program requirements for classifying, collecting and recording information for this QI, QI reporting, including service-level reports, and where to find further information about the QI program. When you are finished, you can end the session by closing your web browser.